Hi, this is Joe Tanti with the Building a Healthier Edmonton podcast. Today, I am speaking with Brian MacDonald. He's a dental hygienist over at the Tooth Doctor on 75th Street. How are we doing today, Brian?
I'm doing pretty well. How are you doing today, Joseph?
I'm great, thanks. So dental hygiene is obviously a big importance for people's overall health. It's definitely a one aspect of healthcare. So just before we get into all that, why did you decide to become a hygienist? What brought you to where you are today?
Well, that's a long story, but the short version is I actually worked in architecture before this, doing drafting, and needed a change. And so my ex-wife at the time, she used to do dental assisting, and I helped her with some of her studies. And I wanted to get into the healthcare field and looked into a few things, and dental hygiene just seemed to fit. And I knew some of the stuff I'd get into because I helped her with her studies. And so I decided to get into that, and I haven't looked back since. So
That's great. Now, how long of a program is, so you were in architecture, so you had to do your undergrad, I'm assuming?
well, I wasn't an architect. I was drafting.
Oh, okay.
And I just worked at an architectural office, but that was a 2.5 year, and I took that out of high school. But with dental hygiene, when I took the course back in Regina, it was a 2-year course. It's gone now to a 3-year course. Pretty much all the schools have gone to a 3-year course. So
Okay. And then did you straight go away right into the tooth doctor's office, or?
no, I actually I'm from Saskatchewan, and I worked at an office there for almost 5 years before I moved out this way. So
Okay, great. I think I mentioned before, we lived in Saskatchewan for a little bit as well. Glad to be in Edmonton now, though.
yes, it's a nice city.
Yeah, it's different for sure. It's a different change, but it's great. So what are some important things about basically oral hygiene, and what are some common things that you see in your patients in terms of issues that they're having with their teeth that they need help with?
I get a lot of questions about home care, and what can I do better? What should I be using? What kind of toothbrush should I use? What kind of toothpaste should I use? Floss, you know, different oral rinses. There's a lot of products out on the market, and like even for myself, when I go and walk through the dental aisle, I can be overwhelmed, and I know what I'm looking for. But for the most part, the biggest thing that I tell patients is find something you like, find something that works for you. You don't need to buy the $20 tube of toothpaste. The $2 tube of toothpaste works as well. The biggest thing is that you're using it. With toothbrushes, same sort of thing. The softer, the better. The hard toothbrushes. When I was growing up in the 80s, I remember the dentist telling me, get a hard toothbrush and scrub as hard as you can on your teeth. We found over the years that that's not the right way to do things, that it can actually injure the gums over time and cause recession around the teeth. And so using a soft or an ultra soft or a sensitive toothbrush, something like that. But again, it's using it. It's not necessarily, one toothbrush is better over the next one. It's just a matter of finding something you like and using that. So that's the biggest thing I found.
Okay. And what do you mean by recession of your gums? What does that mean?
Well, over time, if you're not properly taking care of your teeth and your gums, the gums can start to go down around the tooth, recede away. Normally they should be close or just slightly overlapping the enamel of the tooth, the crown of the tooth. And if we're not taking proper care of our gums, then those can go down and the root can start to get exposed, which can cause other problems like cavities on the root, which sometimes are very hard to fix. And sensitivity is a big problem with root recession. So
Okay. So with regards to sensitivity, I know sometimes if my teeth are being particularly sensitive, I'm eating something, typically if it's hot or sweet, then they just get really sensitive, and they almost, to me anyways, they feel like they're going to break. I don't know. Is that like a thing? Does that happen? Can you actually damage it?
no, with sensitivity, it's very much a just individual people. If you have sensitivity, using a sensitivity toothpaste, but that's really what we do is using a sensitivity toothpaste. But as far as a tooth breaking because they're sensitive, no, I don't think I've ever, in my 6 years of being a dental hygienist, I don't think I've ever come across an experience of someone breaking a tooth because it's sensitive.
That's good to know. I know in my head, I know it's like logically it doesn't make sense that that's going to happen, but that's just how it feels because it's quite painful. One thing that I find happens sometimes if you're at the dentist, they may be doing a cavity or poking around back there, and there's a particularly sensitive area, and they'll say like, "Oh, it's just going to be pressure. It's not painful." And I'll kind of joke with my patients sometimes, saying almost like a similar thing if I'm working on, say, I'm doing some soft tissue care on their hips or wherever, and it's super sensitive. But if there's enough pressure, it can be quite painful too. So
Oh, definitely, definitely.
yeah. With regards to like the hard toothbrush, why is that? Is it just the gums receding that's the main issue, or can that actually like rub off some of the enamel, or can that damage the tooth in some way?
Over enough time, we can get micro abrasions on the enamel of the tooth or on the root if the root is exposed. The root is a lot softer material than the crown of the tooth, the enamel. And so, yeah, over time, with enough pressure, using a hard toothbrush, it's not always the toothbrush itself, but the pressure that we use. We want to be using a very light touch when we're brushing our teeth. The harder we push, the more damage we can do over time. It's not something that's going to happen. You put too much pressure with a hard toothbrush tonight, and all of a sudden you have no gums tomorrow. It takes a lot of years, and some people, I've had patients that are in their 70s and 80s, and they swear by a hard toothbrush and they scrub as hard as they can, and their gums are still fine. And that's why I say it's very individual, and that's why we need to find what works for us and use it. Now, when I talk to patients, I obviously don't recommend that hard or firm toothbrush, but if that works for you and you haven't had adverse effects from it and you've been using it for 50 years, who am I to say that it doesn't work for you, right? And so,
right, yeah, that makes sense. Everyone's a little different. Are there any, or are you aware of anything that people can do to try to make their, I don't know, something they can take or something they can eat, aside from brushing their teeth, that will make their gums more resilient to kind of receding back? I don't know. Is that a thing?
not that I've heard of. In all my studies, I haven't heard of anything like that.
Okay.
The thing about diet is we want to avoid more acidic foods and go with more neutral or base foods, and things like dairy help out to bring the pH of the mouth back to a neutral, to a 7. And obviously things like pop and energy drinks and that sort of thing, candies, they do cause higher acidic levels in the mouth, and that can cause problems not only with the teeth, but it can cause problems with the gums as well, because it creates an environment where bacteria can then flourish, and that bacteria can then harm the gums over time too. So
Okay. What about also like balsamic type or vinaigrette type of dressings, like salad dressings? with those?
The thing about foods is that we want to make sure that we're getting a balance, right? In for just over the overall health of the body, we want to have balance in everything, and that goes for the mouth as well. So it's not like you can't go and drink a Coke or a Pepsi, or you can't have a vinegar based salad dressing. It's what you do, the prolonged aspect of that. So if you constantly have a drink a soda in your hand, and you're constantly drinking that, that's where you're going to run into those problems with the pH levels of the mouth, the acidic level in the mouth. But if you have a little bit of more acidic dressing on your salad, that's not a huge deal.
Right. It's not going to make or break things. It's more about consistency over time, doing same things over time, and plus not brushing your teeth. It sounds like,
Exactly.
As we're all told when we're kids, you need to brush your teeth.
That's right. That's right.
Do you have any suggestions or tips for people to get their kids to brush their teeth? My son, he's almost 2, and he's not a huge fan of it. So we do our best, and sometimes he's very unwilling, but we do our best to try to clean the teeth he has in there. But what do you have any tips, things we can do to get him to brush his teeth, to want to brush his teeth?
I totally understand where you're coming from. I've got 4 kids. They range from 3 to 14. And when they're younger, they all had problems with brushing their teeth. I mean, when the older ones still have problems brushing their teeth. My tip is let them do it. Give them the toothbrush. Let them do the work in their own mouth. But then go in after and help them. So, say, okay, you can start, and dad or mom is going to help you after, just to make sure. And I find that talking about sugar bugs and having fun chasing the sugar bugs around their mouth, take the toothbrush, and after they've done it, you go in and say, okay, let's check and make sure there aren't any more sugar bugs. And there's one, and we'll start brushing over on this side. And then, there's another one over here, and we start brushing over here. And so then making almost a fun game out of chasing the sugar bugs around the mouth, I find helps out a lot.
I like that. I'm going to use that tonight, I think. I'll let you know how that goes, okay?
Sounds good.
That's great. So aside from just, obviously it's important to keep brushing your teeth, flossing your teeth, keeping your teeth, or the hygiene of your teeth, good, making sure that you're having a balanced type of diet, obviously for your overall health, but also sounds like keeping the balance of the acidity level and the pH of your mouth at a good level to decrease the amount of harmful bacteria, essentially. So
Right.
what are some other aspects of dental hygiene that people need to be aware of, things that they can do or may want to keep an eye on to optimize their teeth health?
I think like you've mentioned a lot of the big ones there, making sure you're doing your brushing, making sure you're using a fluoridated toothpaste. There's a lot of people who like to discount fluoride in use in toothpaste, or even fluoridated water in cities and that. But using a fluoridated toothpaste helps out a lot when it comes to the prevention of cavities in the mouth. But beyond doing those things of brushing and flossing, and even using a mouth rinse, if you like to do that, it's not something necessary. But if you want to help freshen the breath and help to kill some of the bacteria, that's a good help. I think the biggest thing is just making sure you're able to get into the dentist to get your regular checkup and cleaning, and go on the advice of those professionals. I mean, when I have a problem with my back, I go to a chiropractor like yourself. I don't necessarily just go to my regular doctor, but go to the dental professional, but then listen to what they have to say. You know, if your hygienist says you should be coming in every 3 months or every 4 months because of these things, it's an important thing to do. I know a lot of times the insurance mindset takes over, and we think, well, I don't have coverage for all of that, but it's important to the overall health of the mouth, and which, I mean, is connected to the body, and then helps with the overall health of the body as well. So
Right. So there's a few things I want to touch on there, but the first one is, when you're giving those recommendations, what are they based on? For example, someone might come in and they may not have any. So I find a large reason people come in, they seek treatment, is because they're having some type of pain. They're probably not coming to you. I'm sure some people do, but a lot of people may not be going to the dentist because, like, if they haven't been in years, they're not going to randomly go because they just feel like they need a cleaning, I would assume. So
usually not the case.
Yes. So then there's obviously the people that they're very proactive, and then they go regularly because they know it keeps their oral hygiene and oral health, as good as possible. But pain is typically, that last thing to come on, but that's kind of that first sign that people have. So what are those things that you're looking for in someone's mouth that may not be painful, but, if left untreated, or if you don't do anything about it, it's going to get worse, and it's going to cause a lot of problems down the road. And if people don't know, like, even if you don't have coverage for it, once it gets to a certain point and your jaw is killing you or your tooth is killing you, you're going to pay anything to get that thing fixed, where it could have been prevented in the first place if you took these small action steps ahead of time. So what are some couple things that you're looking for?
There's quite a few things. A couple major ones that I look for as a hygienist is the amount of buildup, the hard deposit, the calculus, the tartar, however you want to word it. I had a patient that I saw in Regina, and I saw him anywhere between 2 and 3 months. And he could have come every 2 to 3 weeks because he built up that hard deposit so quickly. And so, he was proactive with it, and he had a certain amount of coverage, and he knew that once that coverage was used up with his insurance, he was still going to come because he wanted to make sure that he got that deposit cleaned off. And so I also saw one other patient who was in his 70s, who, you hate to say it, but he brushes once a year, and that's the day he comes to the dentist, and he has never flossed a day in his life, but he has perfect teeth. He has perfect gums. He won the genetic lottery when it comes to the health of his mouth. And so everybody is different. From the gentleman who needed to come in he could have come in every 2 or 3 weeks and had a cleaning, to the guy who brushes once a year and has absolutely nothing wrong with his mouth that we can see. And that's why we try and do individual plans. We say the basic is try and get in every 6 months for your cleaning, and then once a year for your checkup. That's the basic, but then we go on from there to customize for each person. Another thing that we look for is just the overall health of the mouth from what you're doing at home. Are you taking the time? Are you brushing? Are you flossing? Are you doing it properly? There's proper techniques to use versus improper techniques. If your kids just put the toothbrush in their mouth and chew on their toothbrush for 10 seconds, they're not cleaning much in their mouth. They're just wrecking their toothbrush. But then they come out of the bathroom and say, "Yeah, Dad, I brushed my teeth." And so it's how much are they doing at home for their home care? Another thing is a major one. Over time, depending on the different bacterias and genetics and other things in the mouth, we can get bone loss around the teeth, and we call that periodontal disease. the disease of the periodontium, which is the bone around the mouth, or the mouth in general, really. But over time, though, in between the gum and the tooth, we have a little pocket there. And we measure that from time to time. And those measurements, when they get up to between 2 and 3 millimeters deep, we say that's healthy and normal. But when they start to get deeper than that, then we start to look at treatment options as far as bringing patients in more frequently, because at home, there's no way we're cleaning down to a 7 or 8 millimeter deep pocket around the gums and the teeth. And so we need to make sure we're coming in more frequently to make sure that the teeth and the gums are healthy and we're getting everything cleaned out from underneath the gum line there.
Okay. And what will happen if that doesn't get cleaned out, like as that progresses?
Eventually we get if those pockets get deep enough, then we start to see the teeth starting to get loose, and eventually they will fall out, or they'll have to be taken out, or we might start getting an abscess tooth because bacteria gets down there and then it causes infection. And then, we eventually end up losing teeth at that point.
Right. And that can have a pretty, obviously no teeth, it's harder to eat different things.
Yes.
And also, like if you get an infection, that can cause a whole slew of issues. I've heard of people, passing away after they may have a tooth abscess and they don't get it treated for whatever reason, and then they get an infection, and then it gets into the blood, and then they get sepsis.
Yeah.
So it can be pretty serious if left untreated, for sure.
Yeah.
One other thing I want to bring up, just that you mentioned there, the importance of fluoride. So what exactly is fluoride doing? What's its role?
Fluoride is a natural mineral that we find in nature, but we don't find it everywhere. We can find trace amounts of it in certain foods, but not too many. And there are, like, being in southern Saskatchewan, there's a few communities there that have naturally fluoridated water. And when you look at the overall dental health of those communities, you see a very much lower cavity rate in those individuals who grow up there. And that's one of the reasons why we add fluoride to water in some of the major cities in North America. It's very important in the role of preventing cavities, helping to strengthen the enamel of the teeth. And that's why when we brush our teeth, the proper way after you brush your teeth is to spit the toothpaste, but don't rinse your mouth out. That was one thing that I didn't know until I got into school for hygiene. I always used to brush my teeth, rinse, spit, and go about my day. But leaving the toothpaste on the teeth, leaving the fluoride there to help to soak into the tooth helps to prevent cavities better than just brushing alone.
Oh.
And so it's really a preventative measure.
Okay. Well, I didn't know that. That's a great tip. I'm learning so much here. This is great.
Good.
Good. Yeah. Is there anything else that you want to mention, or anything that we haven't discussed that you feel may be important for people to know?
I think just the importance of remembering that oral health, the mouth is linked to the body. There for years there was a disconnect where doctors didn't want to have anything to do with the mouth, and dentists didn't want to have anything else to do with the rest of the body. But there are multiple studies out now that show that the health of the mouth is directly correlated to things like diabetes and heart disease and other blood related issues. And so just making sure that you're aware and don't forget that the mouth is part of the body. What goes in the mouth goes into the body. And so it really is an important, almost the first line of defense for the health of the overall body. So
Right. And do you think that it has more of a in regards to these other health conditions, diabetes, heart disease, do you think it's more that they have these other health conditions and that makes them more susceptible to having more oral hygiene issues, or do you feel it's the opposite, or is it just somehow it's connected?
It used to be the impression that, oh, you've got heart disease, you've got diabetes, and that is totally a separate thing. But we do see now the relationship that one can cause the other. So periodontal disease, abscessed teeth can start to cause other issues in the body, like those heart diseases and that.
Right.
And so it's not one is without the other. It's we have one, let's look and make sure we don't have the other.
Okay.
And so
well, that's
they
great
go
to
hand
know.
in hand.
Okay, that's great to know. It seems to be like with a lot of things, if you're having some type of diabetes, for example, if you have type 2 diabetes, you're more likely to have multiple other type of health issues as well. Not just diabetes. You're more susceptible to having muscle pain, for example, and oral health issues. Well, great, Brian. It was a pleasure talking to you. If there's any way, if anyone has any questions or they need some dental hygiene or they need their oral hygiene to, be evaluated or taken care of, what's the best way for them to get your services?
For myself, I'm not really on any social media platforms myself. I have my Facebook, but that's about it. For any questions, any concerns, by all means, give our office a call. The Tooth Doctor on 75th Street in Capilano. We're more than happy to have new patients come and have consults, and I'm more than happy to have patients come in and let me help them with their oral health needs. We have two other offices, one on Ellerslie in the south end of Edmonton and one in Tofield. And so by all means, any one of those offices, we'd be more than happy to have you come in and talk to you more and help you get on the right path to overall health, not just oral health.
Great. Well, thanks a lot. And thanks everyone for watching or listening. And I'll talk to you next time.
Thank you very much, Joseph. Have a good day.
Thanks. You too.